Right now in Indianapolis, mother and son are in Washington, D.C. to fight for those with hemophilia, a bleeding disorder that affects thousands of children. Some may not even know they have it. WRTV's Lauren Schwenker breaks down the reality of the disorder here in Indiana.
This is 15-year-old Elias and his mother, Vanessa Flores. This family, along with thousands from across the nation, are urging for lawmakers to protect healthcare programs, lower medication costs, and improve access to care for hemophilia A here in Indiana.
Last year, you totaled it up, and the costs were about $1 million for our family.
For the Flora family, hemophilia A is more than just a diagnosis. It is a reality that spans generations. Wednesday, Vanessa and her son Elias headed to Washington to advocate for their family and many other Hoosiers.
Medications are incredibly expensive. It's very hard for a lot of Hoosier families to have adequate insurance to help cover it, so some of them have to get covered through Medicaid.
Bleeding disorders affect around 70,000 people in Indiana and can range from mild to severe.
These trips are very important. I've gone myself and advocated alongside patients.
Dr. David Hendrick, a hematologist in Indiana, says about 1 in 8,000 children are born with hemophilia, and about 1 in 1,000 have a milder form. He says the best way to see if you have it is to know your family's medical history and to see the doctor for any unusual bruising.
Lots of people have some history in their family of somebody, a cousin, a nephew, a distant relative that maybe had a bleeding issue, had bleeding problems after surgeries.
The Flora family's main message is a push for affordable health care for those battling the high costs.
Really just want to be able to live and not have to go into debt simply for trying to live.
Doctors here in Indiana and community members will be in Washington until Friday advocating for bleeding disorders. Reporting in the studio, I'm Lauren Schwenker, WRTV.
Lauren, thank you. Their advocacy is part of an event called Washington Days, which is organized by the National Bleeding Disorders Foundation. The goal is to build awareness, increase funding in support of bleeding disorders research, and improve access to care.